I'm Dr. Sejal Saheta and welcome back to Getting Comfortable in Your Skin. Today, we'll be discussing a very common skin concern that affects almost all of us in some way or the other: scars and stretch marks. Now, when I say scars, most people immediately start imagining a handsome, rugged guy in the movies with a scar being seen as an accentuating feature, or maybe the kid in you is imagining a pirate with a huge scar across the face. But in reality, for most of us, scars are neither of these. Scars, simply put, is abnormally healed skin after it has undergone any form of injury. So, when you injure your skin, the body reacts to it by initiating an inflammatory response to the injury, which first contains the injury and then starts the tissue repair process. During the tissue repair phase, there is a proliferation of cells from the adjoining areas to the injured area, and the wound is closed with the formation of collagen and elastin fibers. However, as the skin and tissue heal, often the healed area becomes uneven and fibrous and therefore has a different texture and quality. This is what we call a scar. As a scar first develops, it's usually pink or red. Over time, the pinkish color fades and the scar becomes slightly darker or lighter than the color of the skin, making it stand out further. Now, scars can be quite varied in their appearance, and this has a lot of factors like the injury or event that caused the scar, such as surgery, a burn, or severe acne, the size, severity, and location of the wound, the treatment you receive for the wound, such as stitches or bandages, and lastly, factors like your age, genes, ethnicity, and overall health. As I mentioned, scars can be quite varied in their appearance and are classified based on the same. The type of scar you have defines the if and how of the treatment, and hence it is important to understand the same. The first type of scars are called depressed or atrophic scars. These are some of the most common scars seen and are sunken scars that occur due to chickenpox or acne. They look like rounded pits or indentations in the skin. These scars are further classified as rolling scars, ice pick scars, and box scars based on their exact shape. It is interesting to note that acne scars may become more noticeable with age because as you age, your skin loses collagen and elasticity and the depressions look more pronounced. Another type of scars are raised or hypertrophic scars. You can feel a hypertrophic scar when you run your finger over it. These raised scars may get smaller over time, but they never completely flatten out. Flat scars are the third type of scars. These scars start off as a slightly raised scars but flatten out eventually. Flat scars are often pink or red initially and later turn darker. The fourth type of scars are called contracture scars. These are most commonly seen when the skin heals after getting burnt. A contracture scar is called so as it causes the skin to tighten or contract. In case scar tissue like this forms over a large area, it can cause issues with mobility, especially when the scarring gets into the muscles, nerves, or occurs over a joint. The fifth type of scars, called keloidal scars, actually form in people who have a propensity for them. These scars are raised above the skin surface like hypertrophic scars, but they spread beyond the wounded area. The overgrown scar tissue can get large and may even affect movement. Also, these scars can get itchy. These mostly develop in case of post-surgery recovery or because of a deep injury. Another common concern that patients often come up with is stretch marks. Now, stretch marks are also a type of skin scarring, but they are not caused because of injuries. They are generally caused when skin expands or shrinks quickly. In this case, the connective tissue under the skin can be damaged, and also there are changes in the collagen and elastin fibers. Stretch marks generally present themselves like lines or striae where the skin seems to have been stretched. In the early stages of formation, stretch marks are reddish in appearance, and as they mature and settle down, they tend to become whitish in appearance. Stretch marks commonly develop during pregnancy, puberty, or after gaining or losing a lot of weight. They can also be caused during certain conditions like Cushing's syndrome, etc. They usually appear on the stomach, thighs, upper arms, or back. I hope this video has been useful in helping you understand what scars and stretch marks exactly are. Do watch out for the next video where we explore the different types of treatment options available for scars and stretch marks.